Okay. Hi, everybody. Welcome. So my name's Tom Cheever. I'm a program officer at the National Institutes of Health, or NIH, and I'm one of the hosts today for our seminar here. And for today's mock review, I'm going to play the role of a chair. And with that, I will turn it over to Julene.
Hi, everybody. My name is Julene Johnson, and I'm the co-director of the Sound Health Network. And the network is an initiative of the National Endowment for the Arts in partnership with the University of California, San Francisco, and in collaboration with the National Institutes of Health, the John F. Kennedy Center for Performing Arts, and Renée Fleming. And for this webinar today, I am going to serve as reviewer 3. I want to remind everybody that if you have any questions, you can type them in the Q&A box, and we will answer as many questions as we can at the end of our session here. So please be sure to put your questions in the Q&A box at the bottom of Zoom, and then we'll get to that at the end. So just as a little context, this webinar is the third session in the Music and Health Grant Writing Series, which is sponsored by the Sound Health Network in the National Institutes of Health. This webinar will host a Music and Health mock study section. We again have invited the music and health research community to join us with some learning objectives. One is to become familiar with the NIH study section review process. Number 2, we hope that you better understand how reviewers present and discuss applications at the NIH. 3, we hope that you learn about the importance of review criteria, which include significance, innovation, the investigator's approach, environment, and any additional review criteria, which you'll hear about today. And finally, we also hope that you gain a better understanding of the roles of the primary reviewers, the panel, the NIH staff, and all of this in an NIH study section review. This webinar will be about 60 minutes and include about 20 minutes of Q&A, but this we'll let it play out as it is. I turn it back over to Tom.
Thanks, Julene. And so just another note here that the discussion and kind of mock study section that we're going to go through here is not like a complete minute by minute recapitulation of an actual study section and discussion of application. It's been abbreviated here just kind of for the sake of time, but you'll get a pretty good sense of like what happens in an actual meeting. And so with that, we're going to kind of kick things off as kind of one of the first parts of a review meeting are some introductions, and through that, you'll get a sense of the other members of the panel here. So I think with that, I'm going to kick it off to our scientific review officer for the day, Xiong, for him to kick things off.
Okay, thank you. Hello, everyone. Welcome to NIH and SHN Music and Health Review Meeting. So my name is Xiyong Huang. I am the Scientific Review Officer of this review meeting. So we very much appreciate all being here today and helping us with this review meeting. So before we go over some administrative aspects, let's go around the table and have everybody introduce themselves and with relevant expertise to this meeting. So let's start with our chairperson, Dr. Cheever.
Thanks, Dr. Huang. So my name is Tom Cheever, and I study geriatric psychiatry and human behavior with expertise in clinical trials of non-pharmacological interventions in Alzheimer's disease. I'm also a musician, and I will be chairing this meeting. So my responsibility as chair will be to introduce the application, keep the panelists engaged during the discussion, as well as ensure scoreable issues are heard without forcing consensus. I will also summarize the discussion, seek final scores, solicit discussion of non-scoreable issues, and ensure we stay on track here. So with that, I will turn it over to reviewer 1.
Good afternoon. My name's Sherry Raw, and I'm serving as reviewer 1. My research focus is on music therapy to manage distress and improve positive health outcomes in children and adolescents with cancer and their caregivers.
Hi, and I'm a reviewer 2. I'm Joke Braat, and my expertise is in developing and testing of music therapy interventions for chronic pain management.
Hi, I'm serving as reviewer 3. My name is Julene Johnson, and I'm a cognitive neuroscientist. and my expertise is in developing and testing music-based interventions for older adults.
Hello, I'm a panel member not assigned specifically to the review of this application. My name is Maria Nurminskaya, and I'm a behavioral psychologist.
Thank you. So we also have other NIH staff observing this meeting. So would you please introduce yourself, Dr. Hilaire Clark?
Hi, my name is Teresa Hilaire Clark, and I'm a program officer at the NIH. My main role at the meeting is to observe the discussion and provide clarification if needed on any institute or center-specific requirements for the Notice of Funding Opportunity or NOFO, under which the applications in this meeting have been submitted.
Thank you, Dr. Hilaire Clark. So as SRO, I am the designated federal official of this meeting. So I invite the reviewers to serve on this review panel based on their expertise and experience. I scheduled the application to be discussed today based on the preliminary scores from the assigned reviewers. My role here is to make sure that NIH guidelines are followed, and I will take notes to write the resume and prepare the summary statement. Before we start reviewing the application, let's go over the cornerstone of a fair and unbiased review. So please maintain the confidentiality of the review and do not discuss review material with others outside of this meeting room. Under no circumstances should the reviews advise applicants. Neither should applicants contact reviewers. Next, it is important to identify any conflict of interest. If you are in conflict with an application, we will put you in the Zoom waiting room during the discussion of that application. If you have any concerns in regarding to scientific misconduct for any of the applications under review, please report them to me in private. We at NIH will take appropriate actions. To make sure that we are all on the same page, I would like to invite our program officer, Dr. Hilaire Clark, to introduce the purpose of this NOFO that the application in this panel are responding to.
Sure, thank you. So the purpose of this NOFO is to promote innovative research on music and health with an emphasis on developing music interventions aimed at understanding their mechanisms of actions and clinical applications for the treatment of many disease conditions. Because of the need for a multidisciplinary approach, it encourages collaborations among researchers with different expertise. This NOFO utilizes a phased R61, R33 funding mechanism to support exploratory and innovative studies. Given the emphasis on innovation, little or no preliminary data are needed to apply under this NOFO. It has an R61 phase with up to 2 years of support and an R33 phase with up to 4 years of support. After completion of the R61 phase, NIH program officials will evaluate whether the go, no-go milestones have been fulfilled by the investigators and decide whether the R33 phase should be funded.
Thank you. I would like to remind the reviewers that responsiveness is not a review criterion. Whether an application is responsive to the NOFO or not is determined by program staff in collaboration with review staff. If an application was not responsive to the NOFO, it would already have been withdrawn from review. As reviewers, you do not comment on the responsiveness. We evaluate the scientific and technical merit of the applications based exclusively on the review criteria in the NOFO. Reviewers will give numerical scores ranging from 1 to 9 for overall impact scores. 1 is exceptional and 9 is poor. Next, I'm going to introduce the procedure of the discussion. The chair will announce the title of the application, and conflict reviews will be placed in the virtual waiting room. The assigned reviewers will then be announced and will provide their preliminary impact scores. Review 1 will present a brief description of the application, followed by the score driving strengths and weaknesses based on the 5 review criteria, which are significance, investigators, innovation, approach, and environment. Reviews 2 and 3 will add additional comments not mentioned by previous reviews, or if in disagreement with previous reviews, we'll explain why. Additional review criteria will be discussed, including go, no-go milestones if they have not been addressed previously, and study timeline, protection of human subjects, inclusion plan, vertebrate animals, biohazards, and resubmissions if applicable. The chair will then open the discussion to the whole panel. After the panel discussion, the chair will summarize the discussion and ask assigned reviewers to state their final overall impact scores. The panel members who are not assigned to the application will also enter their final impact score based on the discussion and the collective wisdom of the panel. If you plan to vote outside of the score range, please state it or raise your hand in Zoom. If the reason to vote outside the range is not discussed, please tell us the reason. And finally, additional review considerations for the budget will be discussed, but will not impact the final overall impact score. Based on the preliminary scores, we scheduled 1 application for discussion today. Applications currently in the non-discussed list can be brought back by any non-conflicting review.
Excuse me, I have a question about scoring. Could you tell us what the cutoff is for funding? Is it a 2 or a 3?
Thank you for the question. In review meetings, we do not discuss the effort. We are here to assess and score the scientific and technical merit of the applications. At the second level of the review, the advisory council will consider the recommendations and the scores in light of IC goals and priorities. The 2 stages of review are cornerstones of the NIH peer review system. We will now begin the review process, and I will hand the meeting over to our chair, Dr. Cheever.
Thank you very much, Dr. Wong. So for today's application, the application is titled Impact of Music Improvisation Training on Brain Function and Cognition Among Older Adults. So let's go ahead and get started. Let's see, and the PI is Mary Wells. We do not have reviewers in conflict with this application, so everybody can stay in the room. And the assigned reviewers are Dr. Robb, Dr. Brott, and Dr. Johnson. Assigned reviewers, please state your preliminary score reflecting your current enthusiasm. Reviewer 1.
I scored the application 1.
Thank you. Reviewer 2.
I have a 3.
Thank you. And reviewer 3.
I gave it a 5. It looks like I'm the one with the most concerns here, but I did read the critiques from the other reviewers. So I will most likely adjust my score based on the comments from the other reviewers.
Okay, thank you. And so I think with that, I'm going to have reviewer 1, Dr. Robb, please provide a brief description of the application and your major score driving strengths and weaknesses.
Okay. So the overall goal of the project is to develop and test the effects and mechanisms of a music improvisation training intervention on self-regulation of older adults with and without mild cognitive impairment. Also to determine whether improvisation training will lead to improvements in self-regulation compared to controls. And then finally, whether improvisation training will be associated with specific changes in, hang on there, let me find my notes, my changes in prefrontal brain networks and ultimately cognitive engagement. So during the R61 phase, the investigators are going to examine feasibility and acceptability of the intervention and study methods. Then they're going to determine its effects on the hypothesized mechanisms of self-regulation. During the R33 phase, the investigators are going to conduct a randomized mechanistic trial to examine the effects of the intervention on self-regulation. And they will also examine pathways of the intervention through mechanistic intermediate outcomes. So the project is highly significant as it has the potential to provide mechanistic insight about the potential benefits of music improvisation training in older adults with mild cognitive impairment. I felt like the assessment of neuromechanisms is novel, as is the music intervention. There was strong scientific rigor, including a carefully constructed methodological approach. And although it's not required, the investigators also provided some strong preliminary data to support their proposal. The investigative team is strong with all the needed expertise to conduct the proposed study. And the environment at UCSF is strong with the necessary and outstanding clinical research infrastructure needed to support the trial. The assessment of cognitive function and psychological well-being and functional MRI measures are going to provide novel mechanistic insights of the intervention that I think will be very helpful to the field. And then finally, their study is well designed with alternative strategies. I did have minor concerns related to details of the team's research plan, but I really felt the strengths outweighed the weaknesses for this application, and that it does have high potential for impact.
Thank you very much. Reviewer 2, anything to add?
Yeah, I agree with all the comments of reviewer 1, but I do think the approach has a few limitations that are worth noting. For example, aim 3 for the R33 phase conducts a randomized mechanistic trial to test the effects of music improvisation interventions on adults with and without MCI, but this appears to be underpowered. And I was also not convinced that the preliminary data on those was strong enough to justify the proposed design in the R33 phase. But other than that, I don't have anything to add.
Thanks very much. And finally, reviewer 3, anything to add?
Although I don't disagree with reviewers 1 and 2, I had a little bit of a different take on this application. This study has a potential to advance the understanding of music interventions for older adults with mild cognitive impairment. However, the lack of adequate details in the experimental description significantly dampens my enthusiasm for this project. For example, there could have been more details regarding how the intervention would be developed. The investigative team is strong and with complementary expertise. However, it appears that the principal investigator and co-investigators do not have a long history of collaboration. I do not feel the application provides a strong mechanistic rationale for expecting this particular music intervention to be optimally refined. And the absence of a functional performance outcome measure seems like a missed opportunity. I also felt that the rationale for the cognitive outcome of self-regulation is not clear. And parts of the analytic plan were vague, and no analyses are described to examine the links between the brain connectivity and the cognitive function as a result of the music-based intervention treatment. Furthermore, based on the average productivity of the candidate, I'm not completely satisfied that the investigator can successfully pull off these studies. That's all that I'll add.
Okay, thank you very much. So now we come to the additional review criteria. So are there any comments on the go, no-go milestones?
So the go, no-go milestones, I feel are adequate to assess the success of the R61 phase and then the transition to the R33 phase. And the investigators are including quantifiable metrics to support that transition.
Thank you. How about the study timeline?
The study timeline's appropriate. Potential challenges and corresponding solutions were discussed, and they included strategies that can be implemented in the event that they have problems with enrollment.
All right, and then protection for human subjects?
The plan for the protection of human subjects is adequately addressed. All precautions are in place. The potential side effects are low, and a clinician will be on hand in case there are any medical problems.
Thank you. And how about inclusion of women, minorities, and individuals across the lifespan?
Yeah, also definitely acceptable. And children under the age of 18 will not be recruited for this study, but that's of course appropriate for what they are examining. So looks all good.
All right. And then how about any considerations for vertebrate animals, biohazards, and resubmission?
Not applicable.
Thank you. So this discussion is now open to the rest of the panel.
Yeah, can I would like to add that I agree with reviewer 3. There was a clear or a lack of clear analytical details, and that was also a bit concerning for me. My enthusiasm for the study was mostly dampened due to some of the weaknesses in the approach that I mentioned, but I do think that those are addressable. Also want to mention that sex as a biological variable was adequately addressed.
Okay. I think the application does have issues in providing a detailed statistical plan, but the sample size is likely sufficient to address the clinical effect in the R33 phase. And the collaboration among the investigators, considering the scientific focus of the application and that music research is an emerging field, a long history of collaboration might not already exist. And then finally, as an established investigator, the PI has demonstrated an ongoing record of accomplishments that have advanced the field. So those are reasons why I didn't share some of those concerns.
I'm not an science reviewer, but may I ask a question here?
Yes, anyone who is not in conflict with the application can participate in the discussion. And since everyone hearing the discussion will be submitting their final scores, so they are also encouraged to participate in the discussion.
Okay, thank you for this clarification. So I, as a non-science reviewer, I have not read the application, but I hear a number of concerns especially from review 3, serious weaknesses, concerns regarding the proposed mechanisms, the preliminary data on those for the R33 phase, and the capability of the team, which doesn't have a long record of collaboration, to conduct the project as written. So these concerns seem inconsistent with the very good scores given by reviewers 1 and 2. Would these reviewers please elaborate a little bit how they came up with these strong scores?
Yeah, thank you for that question. So I have less concerns that the investigator doesn't have the capability to conduct the proposed experiment, since this individual has done a fairly good job in discussing potential pitfalls, but then also giving some alternative approaches. The potential mechanism is also not a concern for me, as the application has this really well-developed go, no-go milestone, which, should mitigate the potential risk in the R61 phase. So I'm feeling confident that the R61 phase would provide the necessary preliminary data that would inform the subsequent R33 phase.
Yeah, I agree with that. I do want to add one concern that I didn't mention yet, and that's related to confounders. So I was surprised to see that the application did not include prior music training as a possible confounding variable. And I do think that that is important to consider, given that the study will use a music improvisation intervention. I think that can be easily addressed.
I would also have liked to see more details about the actual music being used in the intervention, such as details about pitch, melody, and so on. And we need to have a better idea about what type of music will be used in this intervention.
I'd like to offer an alternative perspective. I don't necessarily agree in that although it would certainly be important in research that uses like a standardized music stimulus to provide that information, that it's not possible or appropriate for a music improvisation intervention to provide that level of detail.
Yeah, totally agree with reviewer one on that. I do have one final concern, and that is around treatment fidelity. The application only provides minimal details related to treatment fidelity, yet this is a very important component of any intervention research.
All right, and just any final comments from the panel? And not hearing any, I'm going to try to summarize the discussion that just happened. So this is an R61, R33 application proposing to examine the effect of a music intervention on brain and cognitive function in adults with MCI. The application addresses a clear need in the field, and there's enthusiasm for the project. The investigative team are excellent and have relevant expertise. The environment is outstanding. The go, no-go milestones are well developed. There were some concerns about the lack of details in statistical plan and experimental description, and lack of a possible confounding variable consideration of that, as well as minimal information related to treatment fidelity and the rationale for the specific cognitive outcome chosen. But these concerns are considered addressable. Is there anything that I missed?
I think you covered everything.
All right, so I think with that, we have final scores from the assigned reviewers. So reviewer 1.
I'm going to stay at a 1.
Thank you. Reviewer 2.
I will move up to a 2.
And reviewer 3.
I will move up my score to a 3.
Okay, so the final score range is 1 to 3. If any reviewer wishes to score outside the range, please raise your hand. And if your reason to vote outside the range was not discussed, please let us know.
I will
Maria.
vote outside the range because I have some concerns about the scientific premise for the cognitive outcome of self-regulation chosen. So I'll vote outside. Thank you.
Okay, so all reviewers can submit final scores now.
Yeah, so
And just so I think with that, let's discuss the additional review considerations, and I'll have the SRO introduce that.
yeah, so I want to say that just want to remind the additional review considerations should not have an impact on the final overall score.
Okay, so with that, are select agents research acceptable?
Not applicable.
Thank you. How about a resource sharing plan?
Not applicable.
All right, and then authentication of key biological and/or chemical resources?
Not applicable to this application.
All right, and then are there any budget or overlap concerns?
The budget and the period of support are appropriate.
All right, thank you. So the discussion of this application is finished, and I am handing the meeting back to the SRO.
Thank you, and thank you, our chair. So if your level of enthusiasm has changed as a result of discussion, please update the critiques and criterion scores to align with your changed enthusiasm. So with that, I conclusions this mock study session of discussion.
Thanks, everyone, and we just invite people to put questions in the Q&A on anything that just happened or any questions that might have provoked for you.
And I'll be monitoring the Q&A. So far, no questions yet. So yeah, feel free to answer there. Anything you may want to learn more about what you just witnessed or any other questions you have.
I could start with a question. What aspects are most important for applications to be successful in an NIH peer review? I open that to our NIH staff experts. What aspects are most important for applications to be successful in an NIH peer review?
So I can try to get us started and then invite my colleagues to add anything. the scored review criteria are those 5 elements that we talked about earlier, and then any additional review criteria that are scored. But I think it's important to keep in mind that that it's really the final overall impact score that is what is kind of related to how funding decisions are made. And it's important to know that those 5 individual criteria, those are not just averaged to get the overall impact score. It's actually up to the individual reviewers to decide how to weight their individual criterion based on their expertise and experience to get to that overall impact score. Sometimes some reviewers really put a lot of weight into the approach and significance. Other reviewers might feel that the environment or investigator are more important and might put more weight to that. But it's really kind of up to the individual reviewers following the NIH kind of policy for what these different criterion mean. And anything anybody want to add to that?
Yeah, so I would like add a little bit. So yeah, so from the mock study session, you will see that reviews assess your application based on review criteria. So I think when you prepare your applications, make sure you also look at the review criteria in the NOFO and make sure you have all the information in your application. So review, when they evaluate your applications, they can find the relevant informations. And based on the mock study session, you will see that review have concern about the details, information. So I think that's very important, that you make sure you can understand your applications and your proposed researches. So you provided adequate details about it.
All right, there's several questions coming in. Thank you for the answer to that. Thank you for the first question and the answer to that. So somebody asked, what would be the next step for an application once the review has been completed? And is there a possibility for resubmission if the study is not funded?
I can see that one. So after an application has been reviewed, it takes usually about 3 to 4 weeks, could be longer, for the applicant to receive a summary statement. So after that summary statement has been received and the applicant has had an opportunity to digest those comments and feedback, it's a good idea to reach out to the program officer. And then you can start the discussion as to whether a resubmission might be appropriate, whether you might consider putting in a new application. But it's always best to probably wait for those critiques first before reaching out to your program officer.
Thank you. Another question is, can you please elaborate on budget and overlap?
So I can answer this question. So for budget and overlap, which is additional review consideration, it will not impact the overall impact scores, but reviews still need to evaluate them. So if for a specific NOFOs, they have the budget limit. So, and also review will consider whether the proposed budget is aligned to the project they are proposed. Is any details missing? So, and also for the project period. So for different NOFOs, they have different project period, and you may want to make sure your proposed project is aligned to that.
And Xiong, if I can just add a little bit to that, another thing that program staff look at is, reviewers are looking at the budget and determining if it's appropriate. Is it, in one case, if an application is asking for more money than reviewers think is needed, and there's a consensus amongst the panel for that, that will actually make it into the summary statement, which is like the official product of the review and like a committee recommendation. And in that sense, program has to act on that, and it could require cutting personnel costs or some other kinds of costs. So it's an important point to keep in mind that you really want to think about your budget and try to justify it as best you can, including in the section like the budget justification, because if it's not clear to reviewers, they might say, we don't think this is justified, in which case we will likely cut some funding from the application.
Thank you. Here's a very good question about the impact score. So somebody writes, in this case, reviewer 3 altered her score to more closely match reviewer 1 and 2. What happens though if this consensus isn't reached? Does the impact score just have a lot of range, or is it average? So maybe somebody from NIH can explain then what happens with all these impact scores and how the final impact score is reached.
Shi-Young, you want to take that one?
Yeah, you wanna...
Let me try to answer first. So yeah, so so review 3 can have, in this case, review 3 have alter her score and close to the other, match the others, but in many cases it may not happen. So yeah, so review 3 can stay her scores and even can be worse after the discussions. So but for the discussion of the meeting, we do not force consensus, but we want to make sure through the discussions, any misconception or any facts has been checked. But reviews has their own opinions. They can have their opinion and have their own judgment and give their own scores. So,
and Shi-Young, just to add to that, so if I have this right, so all the reviewers will enter their overall impact scores. There could be a wide range for that, but they are averaged to get the final overall impact score that shows up in your summary statement. Is that correct?
Yes. So the overall impact score you received, you can see from your summary statement, the first page, that is the average of the score from the whole panel who are not conflict with your application. So for them, in this case, review 1 is 1, review 2 is 2, review 3 is 3, and we have another review vote outside the range, assume is 4, and our chair also can vote, can have a score. In this case, we can say is 2, then the average of maybe is 2.4, and we will times 10, that's 24 you receive in your summary statement.
Yeah, thank you.
In my previous life, I was also an SRO, and I agree with Sean that we do not thrive to reach an agreement between assigned reviewers, but we do encourage the panel to listen carefully to the comments posted from different sides of the range, and we encourage the panel to take sides, so to call, not to vote in the middle, but to agree with the one or the other side of the review, and that helps us to distinguish the applications, to spread them over. So it might happen that scientific disagreement happens between reviewers, but because there is a panel of people in the field, it is usually more dilute, this disagreement between two people. So.
Yeah, and then just to round it off, so the final score that somebody can get will range then between a 10 and a 90, and you want to be as close to that 10 as possible, right? If you get a 10, you can start dancing, right, Tom?
Usually, it's all dependent on funding from Congress, but a 10 is a perfect score, and that is you can't get any better than that.
Yeah, exactly. All right, here we have some other questions. How do reviewers for applications get chosen, and how likely is it for someone who doesn't have much experience in this topic of the application to be on the panel? And Jolene, I see that you would like to answer that question.
Oh, that was just, I'm monitoring the questions in the background. So
I'm sorry. It shows up for me as Jolene would like to answer this question. Oh, okay, so somebody from NIH maybe.
Yeah, maybe our SROs maybe just could walk us through your process a little bit.
Yeah, so yeah, this is a very good question. So how do reviews for application get chosen? So for us, when the application is assigned to study session panel, so as SRO, we did a lot of scientific reviews look at these applications and see what expertise needed to cover that application. So ideal case, we can find someone, exactly doing the same research as you proposed, but that's usually not the case. So we make sure for example, we have 3 reviews. Those reviews has expertise that can cover the research proposed in the application. And also we want to make sure these reviews has no conflict of interest with the application. For example, they do not have do not involve the application. They do not have collaborations with the investigator or key personnel in the application. So we have many things to consider when we choosing the reviews. So the second question is how likely is for someone who does not have much experience in the topic of the application to be chosen as a panel. I think the expertise is very important. So whether you have experience as a NIH review, we consider that one, but it's not the main things we consider when we choose a review. So for the NIH, like CSR, they also have a channels, and you can sign up. If you do not have any review experience before, they also allow you to register, and they will give you the opportunity to participate in the NIH study sessions. So you probably want to look into the NIH website and see whether any there should be any information there. So yeah, so that's what I
would I
would
add a little bit here? So as an applicant, you can help the SRO to recruit the expertise which you believe is needed for fair review of your application. You have the assignment form when you submit the application to NIH, where you can list specific expertise which you believe is needed for fair review. You should not provide the names of the people who could be in favor of your research, but definitely specify the field, for example, cognitive science in all the adults in this particular case, right? And that will help and guide the SROs.
Just wanted to say thank you for mentioning that, Maria. I think like as an applicant, I think you want to try to do all that you can to help everyone along this review process. So write a clear application so it's easy for reviewers to identify strengths and address their weaknesses, and help the SROs with, that assignment request form, giving them some additional information of what you think would be important to review. And like Maria said, you don't want to name people, because that will just automatically put them in conflict, and then an SRO can't put them on the panel.
And along the same lines, you can identify people who has a history of scientific disagreements with you, and you may ask not to assign these people to your application. So it is not a guarantee that they will not be assigned, but at least you can try to give some history of previous conflicts that could bias the review.
And I just wanted to add that I think both of our SRO colleagues here it is a very complex job that they have. There's a lot of other policies and factors that they have to take into account in order to have a balanced and equitable panel. And I also want to put in a plug for our SRO colleagues that sometimes recruiting reviewers is challenging. They will reach out to people to ask them to reviewers, and they'll get no response. So just want to encourage anyone listening, if an NIH staff member reaches out to you about participating in a panel, please help us out. This entire enterprise depends on your service here, and so please help us out. Participate in the review panels when asked. Thank you.
Yeah, thank you, Thomas. Yeah, I think it's very important that if you're willing to serve on the NIH review, you can email to the SRO, say, hey, I want to serve in the review panels. So we will keep you in our mind when we have needed the expertise. So, and we really need a lot of help from research communities.
Yeah, I was just going to add to what Gian was just mentioning. even for early stage investigators, you know, I've had a number of questions from ESIs just wondering if they would even qualify to review for CSR or even for the individual institutes. And the answer is yes. You know, there is a training program that CSR offers. So definitely check out their website and you know, see what the path would look like for them.
Thank you. Here's another question. It's been said that people without a postdoc are not even considered for NIH grants. How true or close to reality is this statement?
It is so false.
Thank you, Clarice. I can support that because I got my first NIH grant and I had not done, I mean, I never did a postdoc. So I've been NIH funded. So certainly not true, I would say, but correct, false, yeah.
Yes, definitely false. We have, you know, at NIH, we're huge proponents of training the next generation. So there are a number of opportunities for fellowships, you know, so undergraduates can apply. There are also opportunities for, graduate students, but there are also opportunities for undergraduates through a funded investigator. There's a possibility of obtaining a supplement. You know, there are diversity supplements, for example, that an undergraduate can obtain through working in a lab with an investigator who is funded by the particular institute. So yes, false. Please take a look at the website. You can reach out to any of us if there's anyone in your lab that might be interested in you know, putting in an application for a more junior person.
And may I add, I believe NIH operates on the assumption that if your institution supports your application, then you're a qualified PI. We do not question that. But also I'm wondering whether this question means postdoctoral training or a PhD. I'm not sure whether the person who put up this question meant specific postdoctoral training or PhD. And again, I think everything we said would apply. People without PhD can apply for NIH funding. It might be a little bit more difficult to write a scientific text, clearly developing an idea. And we would encourage you team up with somebody who has grant writing experience, but it's definitely allowed.
And I just want to just add a little bit to this. And so encouraging people to look at the notices of funding opportunity, or NOFO, N-O-F-O. And these are broken into sections. And I think we actually went through this kind of section by section in a previous webinar. But so there's a section 3, eligibility information, that talks about what kinds of institutions are eligible to submit an application. And then also any like individual, like program, a principal investigator eligible qualifications. And just want to just like read to you a line here. So R01 is the most common, or R01 is one of the most common research mechanisms that we have. And what the NIH Notice of Funding Opportunity says is any individual with the skills, knowledge, and resources necessary to carry out the proposed research is invited to work with their organization to develop an application for support. So just to like really just put out there that if there are any degree or training requirements, it'll be listed in the section. But for some of our most common mechanisms, that's what it is. There is nothing from NIH on that. So I hope that's helpful.
And Tom, am I correct that many years ago that was different, that a PhD was required, right? And so I think that's a change. And I think a lot of people keep on hearing maybe from senior researchers or their mentors, because you know, maybe we are not paying attention to those changes because it doesn't apply to us anymore. But I actually only noticed, you know, well after that had changed, like, oh, that's a change in text here. I never paid attention to that.
And just thank you so much for bringing up that point, because I can also just say, as a program officer, I got a lot of calls from people, and it was often early career people, and it would be, you know, my department chair said this, and it was exactly that, like, what their department chair was saying was true 5 years ago, but is no longer true. And so just want to encourage people to like really try to utilize like the NIH website, for example, utilize the program staff. If it's a specific review question, utilize the NIH SRO. I'm not saying don't trust your mentors, that kind of thing, but to just be aware that NIH policies change, and they're changing. They can change a lot in a relatively short period of time. You can try to stay up on this by subscribing to kind of the NIH guide, which publishes notices when things are changing, but even that can be a lot to keep up with. So just encourage you to talk with colleagues. But if you're hearing mixed messages, something like that, like go to the NIH website, reach out to an NIH program officer to just make sure that you're getting the most current information. And just, I want to acknowledge these things change. It's hard to keep up. So just encourage you to utilize like the resources that are available to you.
Thank you. Another question. Many comments are subjective. Are reviewers allowed to indicate concerns without justification of such concern? Can I react to that for a moment? I think I do want to point out that our mock session today was certainly abbreviated, as Tom said at the beginning of our webinar. And I cannot emphasize that enough, because we even had some behind the scenes discussions, and I was the one who kind of mostly say, but hey, you know that during real panels or study sections, we tend to have much lengthier discussions and go back and forth and argue and disagree, and maybe that's not enough reflected, but because of time's sake, we had to abbreviate. But I would say that very often my experience has been that if somebody makes a statement and somebody else questions that, or the person stating it did not offer a rationale, that often others on the review panel will ask for a clarification. Correct? Is that everybody's experience? Like, we're not all just sitting around. Like today, we want to kind of sit around and we gave but we often have, I mean, at times, some heated back and forth of disagreement during these study sections, which I think is the exciting part sometimes.
I would agree, Yoka, with that. I will also add that, as you might imagine, if we have to go over 10 or 15 applications, we have to move through the discussion relatively quickly over a few days of review. But it's important as reviewers that we put a stronger rationale for our opinions, which seem subjective, in in the review, the summary review that we write. And for example, it's really important, if you come out with a strong statement, to back that up in your review, that either is a strength or a weakness where you're making that case. But the person on the Q&A made a really good point that, you know, it feels like it's subjective, but, you know, ideally they've invited experts, scientists, clinicians, you know, with different types of expertise that come in and provide their opinion. But you know, we also have to back that up with logic and examples. Hopefully that answered.
And if I may add here, for example, in this particular scenario, I was an unassigned reviewer, right? So I didn't read the application. But in a real meeting, a reviewer like me would be reading the written critiques, which are much more detailed while the discussion goes on. And everything in the written critique is more elaborate, right? So even people like me who has not read application in advance would have more supported arguments from each reviewer to consider when I am coming up with my impact score for this application. So reviewers take very seriously their job at the meeting, and what is said is not 100% reflective of what is written, just because of the time constraints.
Yes, so yeah, I just want to add a little bit is that, so for each application in the study sessions, we usually only schedule 15 to 20 minutes for discussion. So we will ask the reviewers to focus on the major strengths or weaknesses that impact their scores. So for the written critiques, so we will ask a reviewer to, or training or oriented review, that they need to explain each strength and weakness, why that is a problem or concern, or whether it's a major, you know, flaw. So whether it will impact their score or not. So we ask a reviewer to address it more carefully in the critique and with more rationale and connections. So
Thank you. Another question is about timeline. So could we please discuss the rough timeline of the whole review process? Like how long does it take after a grant is submitted for it to go to study section? Then how long is it till we get summary statement, impact score? And if you do get funding, what is the process like for successfully funded grant? What happens? How long until you actually get the funding? So you get the gist, all the details about the timeline.
So I can try to take a shot at this first. And just the first caveat up front is that this can be widely variable, and that's for a lot of different reasons. But so I'm going to try to give you some rough timelines, but just note that this is not guarantee as to how it will go for your individual application. But so from submission to the review meeting, I would say like roughly 2 to 3 months. And that's to allow it to get into the NIH system, for NIH staff to figure out which study section would be most appropriate for this, and also which institute or center would be the best like home for that application. That's often based on scientific topics. And then it would get assigned to the SRO running that meeting, and then you need to allow time for the SRO to recruit reviewers, which, as I said earlier, is a lot more challenging than it sounds. So that's from submission to the review meeting. Then it's about a month and a half, maybe 2 months, and like SROs, correct me if I'm wrong, from the completion of the meeting to actually getting your summary statement. You'll usually get your score and percentile, if that's applicable, within a couple days of the completion of the meeting, but the full summary statement, that takes a couple weeks, because there again, there's a lot of work that has to go into compiling all those reviews together, writing the resume, which summarizes the discussion of the meeting. And I just want to emphasize that, you might get an email that your score has been updated in your ERA Commons account, but really you want to wait until that summary statement comes out. And I know that is very hard because that is weeks from getting that score, but most of the time, program staff, we can't really tell you anything more until that summary statement has come out then, in which case we're happy to talk about kind of helping interpret what's in the summary statement, that kind of thing. And then so funding, I should just also add, once you get the summary statement, you're not done yet, because there's the final second level peer review, which is that advisory council. And part of the seemingly delay of that is actually just scheduling that meeting. So advisory councils are like another study section. There's about 20 different people from the field that have to get together in the same meeting. And so it takes time to do that. That advisory council needs time to review materials. So that can happen more around like the 9-month-ish period from when you submitted. And then in terms of funding decisions after that it could be within a week or two kind of thing, or it could be even longer than that. And there's a lot of factors that are going into the timing for that. Some are if that institute has any kind of published funding strategy, you may be able to kind of like consult that and see if your application would fall within that. Sometimes that's called a pay line, which might just say applications at this score percentile are better, these are likely to get funded, but you really want to read the fine print on that, because that might only apply to certain kinds of applications. There are other situations that might delay a funding decision, in that your application got a good score, the institute or center would like to fund it, but they don't know if they're going to have the funding for it. So it can sometimes take longer while an institute or center figures out, can we pay this application? So that's another thing where like you can reach out to your program officer, they'll be listed on your summary statement, see if they can give you a sense, but oftentimes we can't tell you anything definitively until a notice of award has been issued. So I know like that is a really hard part, like waiting is the hardest part. And so program staff will try to tell you what we can, but we often don't have that much more information than you. So I'm gonna just go ahead and see if any other panelists want to add to that.
That was awesome, Tom. And the only thing I'll add is that it also is very variable by institute. Some institutes a little bit faster turning around funding decisions, and some can take a little bit more time. So I would say 12 months, sometimes a little bit more than that for some.
And if I may add here, we always, like program officers, we always encourage you to prepare a resubmission. if you are in kind of not sure that your score is fundable, it's better to prepare a resubmission and go ahead in the next cycle or a following cycle. Because even if eventually 12 months later your original application is funded and you have a new resubmitted application in review, this could be withdrawn. It will not affect your funding chances. So, but if 12 months later you learn that your original application was not funded, that's lost time. That's why we always encourage you to talk to us, to see the strategy for resubmission, and to prepare resubmission, not wait for so long.
And Maria, since you just mentioned the word fundable, could we talk maybe about what that means? Like when we say if your score is fundable, and maybe I'll throw in another word that is often used, pay lines. Can somebody maybe address what that means and clarify that terminology?
I think Tom just kind of covered a little bit this. There are ranges of scores which institutes definitely know they can fund depending on their budgets, right? And that can be published on the website. But also some institutes prefer not to set strict ranges, but more make funding decisions based on programmatic priorities, what is needed in the field. So it is not such a mathematically defined scheme for funding, but maybe Carice can talk a little bit more in regards to this particular mechanism that we are discussing today.
And I know Carice has to leave, so maybe I can help with that. Just to expand upon that a little bit. So first of all, like I think this is a part of the process that, like, as an applicant, it seems like it's hard to know what's going on. And you know, there's a lot of reasons for that on the NIH side of things. Like I mentioned, sometimes our budget is uncertain, what's appropriated from Congress, and then even just like how much is left for that fiscal year. There can also be kind of programmatic priorities that Maria mentioned. These will often be described in that notice of funding opportunities, so at least you have a sense of what the NIH is looking for. But it can vary a lot by the institute or center that your application has been assigned to, which you can see that in your ERA Commons account. And want to encourage you, just Google that NIH Institute or Center and see if they have any information on their website. Some institutes and centers put as much as they possibly can on there, others not, and there are reasons for that too, but that would maybe just give you a little bit of a hint. The other sense is, again, talking to your program officer, especially on something that's like a solicited funding opportunity, kind of like this one, for example. It was written by a program officer. They may have a sense for what kind of budget might be possible for this funding opportunity and how many applications they may be able to support. And they may be able to give you hints of that. But I just want to, again, just emphasize that it is a very complicated calculus that goes into how we are able to support applications. And so again, a program officer might be able to give you a little bit more information, but really, like, no one at the NIH can say with 100% certainty if you're being funded until you actually get that notice of grant award that says you are being funded. Congratulations. In many cases, when it's hard to know, like, when do you, if you don't get one of those, when do you know if you will be getting one? And that's, again, where like your program officer might be able to give you a hint about that. But if it has been weeks or months after the review meeting and after, most importantly, the advisory council, there's a pretty reasonable chance you are not likely to get funded. And I think another thing too is just ballpark score range. So like if it's not discussed, it is highly likely that it will not be funded. If your score is above the 50s, which is like the middle of the scale, it's pretty rare for the NIH to be able to reach to that range, although there are some exceptions. There are times, but it's not often. But like I think it was Yoka that mentioned, like if you got a 10, if you're in the teens, in the 20s, those are very good scores. And this is where at NIH we want to fund as much as we possibly can. So we are often just spending at whatever we have for that initiative to pay as far down as we can to support the strongest science. So scores in that 10s, 20s, sometimes 30s, that's still strong science. There's starting to be concerns, but we're really trying to support as much of the best science as we can. And I wish we could be more straightforward in our answers to say if it's this score, it's funded. If it's this score, it's not. But there's just a lot of factors that go in, both scientific, but also budgetary.
Yeah, so I would like to add a little bit about resubmission. So if you prepare your resubmission, you may want to pay attention to the NOFOs your original application submitted to. Sometimes if the NOFO expire, then you cannot resubmit your application to that NOFO. So you may want to talk to program office if there's any other funding opportunities.
I just reiterate that point, that you may not have the opportunity to submit to that same funding opportunity, but there may be others. And that's one of like the prime like benefits a program officer can provide for you, is looking at where you're at and like what are possible other opportunities for you.
And I would like to reiterate, Tom, you've said many, many times today during the Q&A, talk to your program officer, talk to a program officer. And I think I remember initially I was very hesitant to do that. I remember being so nervous. I had a meeting set up and had to talk to the program officer. I was so anxious about saying the wrong thing, or I see Julene nodding. But oh my goodness, program officers are so accessible and so now I feel very comfortable reaching out with questions I might have if I feel a program officer could provide some useful information. So I would like to encourage everyone to, reach out to the program officer and talk to them. They're just really there to help us. And I've experienced that many times.
Thank you so much for that, Yoka, because I have heard that a lot in my time, and it always makes me sad to hear it, because my favorite part of the program officer job was talking with applicants and doing what I could to help them navigate this relatively complex process that is NIH funding or federal government funding. So just to, especially for early career people, to help, program officers, we are people, we are coming from research backgrounds, probably not that different than you, and we're doing this job because we are passionate about the science and passionate about trying to help you support the work that you're doing. So like I just want to encourage people that we are not scary people. This is our job. This is what you pay us to do with your taxes, actually. And for many of us, this is our favorite part of the job, is getting to talk with you about it.
And our review and program actually is separated to parts. So we will do our independent review to evaluate your applications. So feel free to talk to program side about your project. So.
And also, just like if you ever are unsure who to talk to at NIH, I think the program officer is a good person to start with. And if it's not us, let's say it's actually a question specifically about review, we can help connect you to the SRO. If you have a question about what kind of budget is permissible on something, that may not be a program, it might be your grants management specialist, but we can help connect you with that too. So just another thing is we're often like a good place to start, and if it's not us or if it's a different PO, we can help connect you to that person too.
I actually remember, again, my first call to a program officer. I was very nervous and I was not quite sure like where to best apply to. So my question was more general, getting some guidance. And a program officer was at NCCIH, spent an hour with me on the phone. I had sent him an abstract of what I was interested in proposing, and he kind of laid out all my possibilities, which was not at NCCIH, because at that time, NCCIH was not funding anything less than an auto 1, so no R21s, no auto 3s. And so he was just fantastic, laid out all the options for me. And I walked away from that call just so excited and well informed.
I'm just so glad to hear it. And I have this like pretty lame joke that program staff, like, we don't get paid on commission. So like I think like to me, it does not matter if your application goes into my portfolio or goes to a different institute at NIH or even a different federal agency. Like all program staff want to do is like help support science. So really that is what we should be doing, is trying to give you all of the options that we are aware of, and maybe giving you some pros and cons to help inform your decision. But then in the end, it's up to the applicant and their institution to kind of figure out what is best for them. But hopefully a program officer can help you and help inform that decision anyway.
Tom,
I
I'm
don't have
seeing.
any. Oh, so go ahead. I was just going to say there's no other open questions. Go ahead, Julie.
That's exactly what I was going to say. It looks like we have exhausted our Q&A session. I don't know if there's any final thoughts. I think I love the spirit that we're ending on about contacting the NIH program staff for getting more information to help you with your applications. I will add that this session was video recorded and will be put up on a YouTube page so you can share with all your friends. You can look for the Sound Health Network, ucsf.edu, SHN at soundhealth@ucsf.edu for the other webinars that we did and other materials that we have. And I know the Sound Health Initiative app at NIH also has a website that is really great to visit too. And Tom, do you have anything else you want to add?
I just want to just thank every single one of our panelists here. There are also others working behind the scene, and I just want to thank them and thank the Sound Health Network for giving us a platform to share this, and just hope that this was helpful for the community.
Thanks, everybody.
Thank you all.
Bye.
Bye-bye.
Bye.